Measles is a highly contagious virus. It's spread through respiratory droplets or close contact. Prior to vaccination, it had universal infection rate. Usually had an incubation period from the time of exposure to illness of about 10 to 12 days. Symptoms of the measles included fever that was often above 103, cough, runny nose, pink eye, and a rash. Now, this rash would typically occur about 14 days after exposure and last 5 to 6 days. It would start on the face and go from the top of you to the bottom, and typically would start off as little red bumps that would then all get together and make one big red rash. 30% of the people who had measles would develop one or more complications from the measles. These would include diarrhea, ear infections, pneumonia, encephalitis, which was an infection or swelling of the brain, seizures, and even death. Prior to the vaccine's use in 1963, it was a universal infectious rate, meaning that we had 4 million babies born every year. We were going to have about 4 million cases of measles every year. Now, prior to 1980, we didn't have a huge push for worldwide measles vaccination. And in the world, it was responsible for 2.6 million deaths per year. Still in 2014, with about an 84% vaccination rate worldwide, we still see 19 deaths per hour from measles. Now, like I said, there was 3 to 4 million cases of measles per year. Of those, 48,000 people would be hospitalized. About 500 deaths would occur every year. And about 4,000 cases of encephalitis would occur, which is the infection and swelling of your brain, which could lead to seizures, mental retardation, and coma, and then death. Now, the vaccine is typically given at 12 to 15 months, and then a booster at 4 to 6 years of age. It's given in combination with the mumps and rubella vaccine. Now, measles is a common target of anti-vaccine activists, but it's been proven time and time again that it has no correlation with autism. We have 4 million babies born every year. Every year, 4 million people get the measles vaccine. But yet the incidence of autism has been increasing. If it was a direct correlation with the vaccine, it should have remained entirely stable. It is a live vaccine, so there's some contraindications to getting this vaccine. You shouldn't get this vaccine if you're immunocompromised, if you have had a moderate to severe illness, if you're on chemotherapy or have cancer, if you're around somebody who has a severe immunocompromised state. You may want to check with their doctor to see if it's safe to be around them following the vaccine. Complications or side effects after the vaccine are usually pretty minimal with pain at injection site, but sometimes 6 to 10 days after the vaccine, you can get fever, fatigue, and break out in a measles-like rash. This rash does not mean we're contagious, although it is the measles component that causes it.